So this is the implant that we are going to place at tooth number 11, where we have a missing central incisor out here, and it will be a guided implant system. So we are going for guided implant surgery. This is of Dio Navy implant. This is the guide that has been prepared by the company Dio Navy, which is a customized guide for their implant system. And check this guide where the implant guide is set up here, and it goes into the mouth. There it gets fixed, and through this guide the implant will be set up. So this particular system actually helps in the ultimate precision for the implant. There is nothing on guesswork, where we actually see the end result first, and then we decide which implant to put and how to put. So that's the ultimate cosmetic and functional property that we get through this implant. This is the actual surgical kit for the Dio Navy implant guided system. Look at the size of the punch that we have given. This is just the thing that you need to put an implant. Just a little bit of hole. It's a keyhole sort of a thing, and that is enough for putting an implant over there. Put one implant or 5 implants or 6 implants, so there will be just 6 holes in 6 implants and 1 hole for this. That's all. That is the overall soft tissue that you are going to cut in this particular surgery. So this is one of the biggest advantage, so that there is very less amount of tissue removal in this case. Of course, it depends from case to case, but most of the cases it is just a punch. That's all. So this is the final guide drill that we are achieving. So we have achieved the final length of the implant. Now we will increase the diameter and gradually. So this protocol is a bit different from the conventional protocol, where we gradually increase the length, and here we increase the length at the first go with the guide drill, then we increase the diameter, and ultimately gradually we increase the diameter, and ultimately we reach to that length with that diameter. So here we are gradually increasing the diameter as well as the length. Previously we went to the full length. Now we are increasing the diameter and gradually increasing the length. Now we are going for the profile drill. This is the profile drill which we are making the profile for the abutments and all, and see the amount of bone that we can collect, which is actually very good for making these grafts, if we need any grafts and all. So that is very helpful. See the amount of bone grafts that we autogenous bone graft that we have collected. This is the last drill that we are going before the implant. It is an 11.5 mm implant and of diameter. This is the last drill of 3 mm. Now this is the drill hole that you can see. It is just a point actually, which is a keyhole perfectly, no cuts anywhere else, absolutely clean, and no traumatic implant fixation. This is the implant system that we are working for, and here is the implant that we are placing inside. I am showing you the implant right away. So we are placing an implant of 3.8 diameter and 11.5 mm for tooth number 11. So here it comes. where you can see the implant inside, which is properly sealed and packed. So here is the implant. Now I'll put it into the patient's mouth. So remember, we have drilled with a diameter till 3 mm, and now the implant is going in as 3.8 mm, so it will be actively retentive. So let's go in. Ready? We finished the implant closure. This is the cover screw that we are putting in. We will take another RVG after the cover screw. See, cover screw is fixed. There we have placed the cover screw. You can see it. Perfect placement. So the implant has been properly placed. This is without the cover screw, and this is after the cover screw. Here you can see there was a little bit of space which we actually manipulated on this, and when the implant went down for another 0.5 mm and the cover screw was placed. And after this we will open it after approximately 12 weeks, and after that we will put the superstructure. That's all.